Good afternoon, everyone. My name is Robin Young, and I'm the publisher of Orthopedics This Week. And here are the top 10 orthopedic and spine stories for the week of March 27th, 2023. And our number 10 story, of course, is our power rankings. Make sure you check those out. This is where we surveyed 26 of the largest orthopedic and spine companies, and we rank order what we think are the most attractive 10 orthopedic or spine companies this week. It's kind of interesting, so do check it out. Number 9 this week is a pretty dramatic randomized clinical study out of New York University's Langone School of Medicine. This study documented how precisely critical nutrition is to preventing surgical complications. And I want to give you a couple examples of this just to illustrate how dramatic this study really is. And this was a randomized control study, by the way. Only 2.1%, we're talking about patients who receive nutritional supplements versus patients who don't, who are undergoing surgery. So only 2.1% of patients who received a nutritional supplement had an in-hospital complication, while 23%, remember 2% for those who got nutrition, 23% of those who did not had complication rates. That's a 10 times higher rate of complication, nutritional supplement versus none. Another example, patients with a nutritional supplement had a 3.4% rate of wound healing complications, while those who did not get a nutritional supplement had a 17.9% wound healing complication rate. And here's the final one. Patients who come back to the operating room after their surgery within 90 days. In this study, those patients with a nutritional supplement, none came back. Of those who did not have a nutritional supplement, 12.4%, 1 out of 8, came back to the OR within 90 days of surgery. Like I said, those are pretty dramatic conclusions. Our number 8 story this week is news that New York's Hospital for Special Surgery has teamed up with Orthopedics to facilitate. Now, those surgeons at HSS routinely come up with good ideas, interesting ideas for improving and innovating on surgery. Well, now HSS has formalized through Orthopedics a mechanism to get those ideas out and potentially commercialized. One thing about HSS, they are always innovating. Our number 7 story this week is an update on that massive spinal cap kickback scheme litigation in California. This has been going on for a couple years or more, and the case has ensnared hospitals and surgeons and companies, and it does look like it's nearing its conclusion. The latest news is that one of the surgeons involved, Dr. David Payne, who accepted $315,000 in bribes, was found guilty. He's facing jail time. Does not mean he will serve jail time, but the guidelines are as much as 50 years. Pretty stiff stuff. Anyway, number 6 is the good news that this year's winner of the 2023 Kappa Delta and Donovan Award for Clinical Research, which was recently announced at the American Academy of Orthopedic Surgeons annual meeting, was Dr. Michelle Gert, who is professor at McMaster University, Hamilton, Ontario, for her work regarding the prevention of surgical site infections through antibiotic prophylaxis following oncological reconstruction surgery for bone tumors. What's unique about her study is that it involved the largest collaborative effort ever done in orthopedic clinical research as far as the number of countries participating is concerned. It is a huge logistical accomplishment, and for that, Dr. Gert wins the very prestigious Kappa Delta and Donovan Award. Our number 5 story is another great piece of news, and that's the 2023 Diversity Award, again from the American Academy of Orthopedic Surgeons, and it goes to Dr. Mary L. O'Connor. Dr. O'Connor is the Professor Emerita of Orthopedics at the Mayo Clinic, as well as past Professor of Orthopedics and Rehabilitation at the Yale School of Medicine. She is the co-founder and CMO of Vori Health, This is an award-winning nationwide virtual specialty medical practice designed to enhance the treatment of musculoskeletal pain. Congratulations to Dr. O'Connor. We have a lot more details of these remarkable women and also Dr. Gert earlier. Coming in at number 4 is this is a really, it's interesting to watch all the different avenues and corners that artificial intelligence goes. Here is a really innovative smartphone-based diagnostic tool. It uses an AI platform and all the visual capabilities of the modern smartphone to scan the foot and diagnose podiatric issues. It's really an amazing tool. It's the first of many such tools I suspect are going to be coming out over the years. Where we're definitely entering into a new era of musculoskeletal healthcare. Our number 3 story this week, another great piece of news, is a new treatment for fragility fractures. This is an underdiagnosed and very difficult treatment problem. It affects millions of elderly patients annually. Typical case, elderly patient falls down, breaks her hip, but also often experiences a fracture of the pelvic bone. Fixing that pelvic bone is really difficult. Now there is a curved IM nail, 7.5 millimeters. This steerable curved intramedullary nail works beautifully. Check it out. We have, as a matter of fact, we have a master class on this on our website. This is great news for trauma and large joint surgeons, and certainly for fragility fracture patients. Be sure to check this out. Our number 2 story this week is a new study which was conducted at 13 centers over 12 states, enrolled 60 patients. It's a randomized clinical study that tested the efficacy of viable cell therapy. Interestingly enough, it also documented a dose response, very interesting. And the high dose was really the dosage that showed a clear clinical effect. What was that effect? 1 injection, statistically significant pain relief and improved function that was sustained for at least 2 years. It's a great study. The clinical investigators raved about this approach. Viable cells in the disc to treat degenerative disc disease. Interesting. And our number 1 story this week has to do with Amazon. Amazon could well start offering their 300 million customers healthcare services at a fee of $199 per year, kind of like Prime membership, but with extra benefits. What's going on here? Well, this will affect our musculoskeletal sector significantly. While it remains to be seen how it'll all work out, fundamentally, it's in fact a way for Amazon, and Amazon is joined by Apple and Google in this basic attempt to disintermediate certain parts of the healthcare provider network. But they are trying to find a way to use their base of customers and data sets and artificial intelligence and so forth to disintermediate large chunks of the care provider system. Will it work? I suspect on some level it will. So be sure to read about this at ryortho.com. It's an important article, and we have, of course, many more as well. So thank you all very much, and I wish you all a great week.